Hello, I am Dr. Lawrence Smith, Dean of the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. Thank you for tuning in to Well Said. In a culture of community, scholarship, and innovation, the Zucker School of Medicine is dedicated to transforming students into doctors who will improve healthcare, inspire change, and better the lives of the people they serve. It is why we are pleased to collaborate with WRHU Radio Hofstra University to bring you a program committed to sharing expert discussion and insight on health and wellness topics important to you. Join us today and each week for a recommended dose of Well Said with your host, Dr. Ira Nash.
Hello, I'm Dr. Ira Nash. Welcome to Well Said. As part of our series on COVID-19, we've previously talked a lot about the diagnosis and treatment of acute infection, the vulnerability of specific populations, and the impact of the pandemic on our society. More recently, we've also discussed virus variants and the critical importance of mass vaccination as the path to ending the pandemic. Today, we'll be discussing the lingering symptoms that many people with COVID continue to have long after their acute illness has resolved. My guest is my colleague, Dr. Ankita Sagar. Dr. Sagar is the director of the COVID Ambulatory Resource Support, or CARES program at Northwell Health, and an associate professor of medicine at the Zucker School of Medicine. Ankita, welcome to Well Said.
Thank you for having me.
So let me first ask how you've been doing during what has been an extraordinary year for many of us.
Well, it's been quite a year for many of us, like you said. I think I've been personally very fortunate to have a team that is very supportive, but also amazing in directing us on patient-centered approaches, but also teamwork. So it's been an interesting year.
Well, I'm glad you could look at it as being interesting. That's a word that I think many people would like to be able to apply to this year. To get started, many of our listeners are probably familiar with the initial signs and symptoms of having an acute COVID-19 infection. Over a year into the pandemic, we've seen more and more evidence that some patients experience conditions that seem to be related to COVID-19 even after they've recovered from that initial illness. And I'm sure our listeners have heard people refer to long COVID or long haul COVID. Could you briefly summarize how this came to light?
Sure, absolutely. And I think it's a very important point that you're bringing up. The fact that patients were having symptoms that were persisting for weeks after their initial infection was brought up to light based off of both patients, family members, caregivers, but also physicians that were taking care of these patients and other team members. So once it was becoming more and more apparent, there were studies starting to get published about cases of patients having these symptoms for a long time afterwards. And those studies eventually started to grow a movement that started to look at what does long COVID mean? What does it look like? And I think it's still being worked on because it is so unique for each person and the way that they experience their symptoms after COVID.
Yeah, well, it's interesting that you mentioned that we're still learning about it. And I guess that's been a hallmark of our collective experience with COVID from the very beginning, that as we spend more and more time exposed to this virus, exposed to this pandemic, we continue to learn things that we didn't know 3 months ago, 6 months ago, or even a couple of weeks ago.
Absolutely. So I think our learning curve around COVID has been quite steep, but I think it continues to grow. And what I mean by that is to think about it as saying, this is a brand new illness that we have not seen before. And we're starting to learn about not just what it means for the person now, but what it might mean for them 3-6 months later. But now we're also starting to look at what does it mean for people who are infected a year later. And I think there's much more data to be collected.
So we're going to talk at some length about the specific symptoms that people have for this long period of time. But just a couple of basic questions before we get there is, how do we know that these symptoms that people seem to have long after their acute illness seems to be resolved. How do we know that that's related to the virus? How do we know it is actually a reflection of the COVID illness?
That's a great question, and I think it's a question that we continue to try to answer. One of my best practices has been to take a good amount of time in understanding what the symptoms are, when they started, and even if they were there before COVID, has anything changed since COVID? Because it's the subtlety in what people are experiencing that we need to bring to light when we are seeing them in our teams and in our facilities.
When we say long-term or long COVID, how long are we talking about here?
I think that's a little tough to say because I have had patients who've had symptoms for maybe a month, so up to 4 weeks afterwards. But then we've also seen patients at Northwell, and it's been reported in our journals and studies that patients have had persistent symptoms for more than 6 months. So I think there's a very wide range.
Wow.
Yeah.
Yeah. All right. So let's talk a little bit more detailed about what some of these symptoms are. Now we know that COVID-19 is a respiratory infection, right? It primarily affects the lungs, and so some patients have persistent breathing issues. They feel short of breath, or they have a cough, or they feel like they can't exercise as much. Is that the most common of the long-term symptoms?
Those are common symptoms. There are a few other symptoms that are not necessarily related to our lungs that are showing up for patients who do have long COVID. And I think those are equally as prevalent. So things that could be persistent fatigue or really feeling that we can't complete our activities that we used to be able to do before. The other one is going to be change in sleep. So a lot of patients have mentioned and studies have noted that people develop insomnia or lack of sleep or difficulty initiating sleep after having COVID. And that's been actually quite much more common than what we initially suspected. And others have noticed change in their nails or hair, especially hair loss, in the first few months after recovering from their COVID infection.
Wow. I'm trying to think of something that could connect sleep disturbance, fatigue, and hair loss. It sounds almost like there's a hormonal imbalance that is triggered by this. Is that borne out by the evidence that we have now?
I think that's a great theory, right? Or hypothesis, I should say, that maybe it is related to hormonal change. And maybe that hormonal change has to do with the amount of physical and emotional and mental stress the body goes through when somebody has COVID-19. We don't quite have the answer on whether there is a true change in hormone levels or response of the body to hormones yet, but we're hoping that in the near future we should be able to answer that question better.
And is it the case that when people have these and perhaps other symptoms, is there any particular laboratory finding or blood test or imaging test that you and other doctors can do to say, oh, this is from COVID and we understand why it's happening? Or is this all still kind of evolving?
I think it's more of the latter in the sense that it's evolving. Now, if somebody does have shortness of breath or they are becoming short of breath when they're active, we can do certain exams, like a pulmonary exam, to look at how much our lungs need to work when we're breathing, or to do imaging, so things like a CAT scan or an X-ray. But for the most part, we have really been depending on what the history of the symptoms and the story behind the symptoms, so the evolution of those after having the infection, to help us understand whether it's COVID-related or maybe it's something else.
In those folks who do have that persistent sense that they can't exercise the way they once did, or they get very easily short of breath, Do those tests, those breathing tests and imaging studies, show persistent damage to the lungs, or is it something that's more subtle than that?
I think that there's two groups of patients. So one group of patients will be those who had very severe COVID. Maybe they were in the hospital, maybe they were managed at home, or maybe they required an ICU stay. And we think those people are going to have a harder time recovering, and they might have these changes in their CAT scans or in their lung tests that we would see related to COVID. The majority of the patients may not show any significant difference between their CAT scan before COVID or after COVID, but it really is the sensation that they're not able to quite catch their breath when they are doing very routine activities. And
so I want to make sure
Sure.
Yeah, go ahead. I'm sorry.
No, that's okay. And I think it's a really tough diagnosis to make, because we really want to be sure that we're not missing any other diagnoses when we say this is only COVID related and nothing else.
Right, but what I'm hearing you say is that there are people who have persistent breathing issues, the shortness of breath, easy fatigability, and may not have any objective findings on a chest x-ray, a CAT scan of the chest, or some of these more sophisticated breathing tests.
Yeah, absolutely. And they might also not have any objective findings on any lab work that we may send off. But what they're reporting is a significant decrease in what they were able to do versus are able to do now.
I'm sure that raises in doctors' minds and probably in some patients' minds as well, whether this is a physical consequence of having had the illness or something more perhaps psychological. Can you address that issue for us?
Sure, and I think that's a fair question to ask. What our studies have shown is that patients who are recovering from COVID-19 are also showing increased signs of having either anxiety or having some depression or depression-like symptoms during their recovery. So for those patients, we have to be very mindful of how our body and our mind react to going through trauma and stress. And I think that when a patient comes in who is short of breath and we think it's from COVID, but we can't prove it through a test, one of the main concepts is to make sure they understand that there might be a little bit of anxiety going hand in hand, but if they're having so much shortness of breath that they can't do their activities daily, then it is not just psychological or attributed to psychology, but it really could be something more in the lungs as well.
That makes the point that you were speaking to earlier, that it really takes a detailed conversation with a patient to tease apart these different components to their symptoms. It's not like you just do a blood test, get a result, and prescribe the right medication, right? It's a much more subtle evaluation than that.
It is. And I think it is also a lot of work on the part of the patient. And I'm very mindful of that, because they have had to tell their story 3 or 4 times to 3 or 4 different doctors or clinicians. But that takes a lot of effort. So while it's a lot of effort on the team's part, it's also a lot of effort on the patient's part to be able to give us all of these details.
That brings up another related issue or symptom that I think many of our listeners have probably heard about, which is this thing that goes by the term brain fog. Can you explain what that is and how that might be related?
So the best way that I know to explain brain fog is to feel like your mind is under like water and you're really not able to think very clearly. Sort of like what happens when we think we know the word and it just wouldn't come to you. That's exactly what brain fog feels like. What it looks like to our family members or caregivers would be tasks we were able to do before we're not able to do now. So things like going to the grocery store and not remembering necessarily what we were supposed to pick up, or addresses or directions to a place that is very commonly visited by the patient. Or it might be even more subtle than that, which is, usually you're very good in kind of keeping your books or keeping track of your money, and then all of a sudden you're just not able to add or subtract as fast as you were able to do it before.
So this sort of impairment of higher cognitive function, or sometimes called executive functions, is that what you're talking about?
Yeah. Things that, we, in layman's terms, we say, okay, if I take a nap and I'll be fresh in my mind and be okay. But that freshness kind of sort of doesn't come to us even after taking a nap.
And how prevalent is that? How often do people get that after COVID, and how long does it last?
There's a couple of studies that were done in patients who were hospitalized. Now, these are people who were hospitalized because they had very severe COVID. Some of them had ICU stays. And what it showed that they did have some cognitive difficulties, pretty prevalent, after 3 or 6 months. So when we think about the patients that I'm seeing in my primary care office or we're seeing in other offices, what we notice is that it's common, but it's probably not the top symptoms. But it's very difficult for the patient. So you're going to have a group of patients that are walking in who are very, very good at what they do, and they just can't get back to it. And
it must be enormously frustrating.
It's very frustrating. It also increases the likelihood of developing anxiety and depression because you're not able to use your skills. And it's also quite debilitating because it requires a ton of work on the part of the patient to recover from it.
You mentioned that some patients who were sick enough with COVID to be in the hospital or even in an ICU are more likely to have some of these longer-term symptoms. I wonder if you could just speak to the issue about whether that's specific to COVID, or is that just a consequence of having been really sick? And we know that there's a syndrome of what we call post-ICU syndrome, where anybody who's sick with anything, if they've been in an intensive care unit for a period of time, may take quite a while to fully recover some of the things that we're talking about, their mental faculties, their sense of well-being, their energy level. Do we know yet whether that's just from being in the ICU, or is this specific to COVID?
I don't think we know this quite yet. One of the reasons is because we are just starting to look at people who had very mild COVID and never went to the hospital, or just were able to manage it at home. And I think when we're able to compare people who didn't get to the hospital and were managed at home, we will be able to really see, is this related to only an ICU stay or not? The fact that you're mentioning this, I think, is really important, because one of the things that we need to learn from all the ICU literature is that recovery involves the patient and the family and the caregivers, and to make sure that we're understanding their stories and their narratives and giving them resources that they need. And I think a lot of programs that are trying to address this are trying to really keep that at the center of their program to make sure that resources are being given based on what the patients need rather than what we think is the best thing to do for the patient.
Yeah, I mentioned just a moment ago that, well, what I said was that these longer term issues are more likely to occur in people who had worse cases of COVID. Is that actually the case, or that's what you're saying we're not entirely sure?
I think that there's only been a handful of studies that have compared people who've had severe COVID requiring ICU stays to people who didn't require an ICU stay. So I don't quite think that we know exactly how much of these symptoms are present in patients who never went to the hospital. And I think those are the studies that are going to come out this year and start to really look at them.
And what about other patient characteristics? Is this more likely to occur in people who are older or who have high blood pressure or other kinds of chronic medical conditions?
We don't know, but I can tell you anecdotally that patients that I've cared for who've had long COVID, they run the full spectrum, where I have people who are young and I have people who are older, but I also have people who have a lot of illnesses, but then I have some people who are kind of like your marathon runners, are doing really well, have never had any illness in their life before. So I think that we don't quite understand why COVID affects one person in a certain way versus another, especially when it comes to long COVID. So all of these questions are good questions to have. So we don't
well, it goes back to what we were saying before, that we're all collectively learning more and more about this illness as this pandemic drags on, and some of these things may not be known for quite some time.
Right. Yeah, absolutely.
There have been media reports of people with these persistent symptoms who then get vaccinated against COVID-19, and the vaccine, which is supposed to prevent people from getting sick with COVID in the first place, seems to improve their symptoms that they have from having had COVID before. What do you make of that?
I think that there's definitely a handful of patients that do feel better after their vaccine, and I'm not sure we know the exact reason why or the pathway or the physiology of what that means or why it happened. But I also know of patients who've had long COVID and had a little bit of worsening of their symptoms in the first week, or the first few days, I should say, not even a week. So I'm not sure that we quite understand the details, but I think it just points to the fact that COVID vaccines have a potential benefit that we may not know. So even more people should get the COVID vaccine, even if they've had COVID before.
Yeah, let's not miss an opportunity to underscore how important it is for people who have not had COVID to get vaccinated, right? I mean, that's everything we're talking about is preventable if people get vaccinated.
Yes, I'm all for COVID vaccines.
I mentioned as part of the introduction that you are directing a program at Northwell Health called the COVID Ambulatory Resource Support Program. Could you tell our listeners a little bit about what that program is about?
Sure. Thank you for the opportunity to talk about it. So this program is a multidisciplinary team, and what I mean by that is we have folks who are clinicians that specialize in internal medicine, but also in behavioral health, in surgery, in OBGYN. So across the board, we have a lot of the clinicians that have decided to kind of come together and say that we are going to approach patient care, especially for those who have COVID or long COVID, in a very interdisciplinary team way. And this team has really been sitting on the shoulder of our other team members. So that's Northwell Network Care and Health Solutions, Northwell at Home, and the Crown Program, to really deliver as best care as possible to patients, whether it's in our practices or in our rehab facilities or at home even if needed. And the goal of the program is to really get our patients who have new infection with COVID recovering as fast as we can, or those who have long COVID be set up with evaluations and therapies with people who have expertise in long COVID.
And so if somebody's listening to us at home and has symptoms or has a loved one with persistent symptoms, how can they get more information about this program and get plugged into the wonderful services you're talking about?
So it's very easy. You can call us. That's probably the easiest way to get plugged in. And I can give you our number. It's 855-569-4227. There is
Say that again.
855-569-4227. It is open 24/7, and it is our Northwell Network Care team members who take the call and get you enrolled into the program.
And where can our listeners go for more information in general about long COVID or long haul COVID? If not necessarily seeking care, but just seeking information.
I think through the Northwell Coronavirus Resource Support, or Resource Center, I should say, has a great website. It is available on northwell.edu. If you go to the homepage, you can click on that. There's a lot of good information. And we have been trying to update our website also, which is northwell.edu/cares. So that's northwell.edu/CARES. That also has information about long COVID and what to expect, including a patient care guide.
That's wonderful. So last word, what would you say to somebody who is suffering with these symptoms or has a loved one who's continuing to suffer with this? What do you think their future looks like?
I think the future is promising. The key is going to be that we seek out help and we seek out evaluation with experts who have really made this their purpose in life, is to treat patients with long COVID. And it takes some work, but find a team that you can belong in. And I think that from the patients who have recovered that I have seen, they're doing great. So it's a matter of getting you to that endpoint that you want.
I think that's a great place, a great note to end on. And I want to thank you for joining us today.
Thank you for having me. This was a pleasure.
My guest has been Dr. Ankita Sagar. Dr. Sagar is the director of the COVID Ambulatory Resource Support Program at Northwell Health and an associate professor of medicine at the Zucker School of Medicine. For more information about this program and to find past episodes, please visit sites.hofstra.edu/wellsaid. You can also subscribe to our free podcast available on Apple Podcasts, Stitcher, or wherever you get your podcasts. Our listeners are welcome to send comments, suggestions, and questions to wellsaid@hofstra.edu. Until next time, I'm Dr. Ira Nash, and that's Well Said.